Well, sports injuries create a drastic change in your life. It happens by a trauma, it's unexpected, and all of a sudden it creates pain and inflammation. And either you can take a lot of medication or you undergo a surgery to repair what has been broken, and you have to fight the inflammation.
So even if a patient has a normal standard procedure performed, such as a rotator cuff repair of the shoulder or ACL repair of the knee, they may still have pain. So at that time, we come in with adult stem cell therapy and decrease inflammation. Now, if someone does not have a structural problem that needs surgery, then we just go straight to adult stem cell therapy to help decrease inflammation and promote healing.
We use stem cells at Okyanos in two different ways. We give injections intra-articular to help the cartilage grow. We also give them IV to reduce inflammation. When we give stem cells IV, our hope is that we're reducing scar formation.
It depends on the tear, but for example, in the knee, if there's a cartilage tear or a meniscus tear, but the patient has full range of motion of the knee, then you want to leave that cartilage in there and try to promote healing. So the best way to do that is through adult stem cell therapy, where the cells are isolated from the patient's own body and then injected back into the joint to decrease pain and promote that healing.
Everyone has to understand that stem cells cannot solve mechanical problems. Meaning if there is a fracture or a free piece of bone, you still have to remove it with scope or do the surgery. However, as long as there is mobility and I have no mechanical blocks, I can do a lot with stem cells.